going to show you how to do a wet to dry dressing change. So after I've come into the patient's room, identified the patient, made sure that they were supposed to be getting a wet to dry dressing, I would have performed hand hygiene, put on a pair of clean gloves, and I would remove the old dressing. When I was removing the old dressing, if I had any trouble, if it was sticking or if any of the old gauze was sticking in the wound, I would use sterile water to remove that. And then I would note if there was any fluid, the amount of fluid and drainage that was in the wound, what it looked like, if there were any odors, any signs of infection, anything like that. So then I would remove these gloves, I would perform hand hygiene again, and then I would come over to where I had my kit for the dressing change. I would also have a container of sterile water. If it was a container that had been open within the past 24 hours and had been used, I would take it, I would pour a little bit out of the top to lip the top, and then I would use that. If it was a new container, I would just open it. So I'd have that as well. And I would have my, my kit. So now I'm going to get the kit ready to put on the new dressing. So I would open up the kit, and this is going to be my workspace. I'm just going to turn it like that. And then I would take out the sterile gloves. And then before I do that, I'm just going to move that a little so I have some room for the sterile gloves. You'll still be able to see that. Okay. So I take out my sterile gloves. Open my sterile gloves. Reaching the outside for my dominant hand. I'm gonna slide in my dominant hand. And I'm gonna come over and swoop down with my fingers to get my non-dominant hand. Then I would get rid of that garbage. And I am just putting this back into view, but I would not do that normally because it would break sterility. Okay, so I would have my sterile gloves on. I would take out the drape if I needed to. I would place it underneath the wound to keep the area dry. Because of the skills trainer, it's not really conducive to that. So I'm just gonna put that aside. And I would take out my supplies from the kit, pick up the edges of the kit, and I would dump this out into my work area. And then I would keep this over here, and I would take that sterile water I told you I had before, and I would dump some of that in here because I'm going to use that for the wet part of the dressing. So then I would have everything out here. If it called for it, I would irrigate this wound with saline, or at the very least, I would clean it out with some gauze, you know, make sure it was all cleaned, wiped, dry. I would dispose of that. This does come with this bag that I could use to dispose of everything as I'm going. So I have that. So now I have some gauze that I'm going to use to fill the wound. We have scissors and forceps if I need them. If I wanted to measure the wound, I have this, so I could stick this into the wound to see the depth and measure the depth of that with this applicator, so I can note that. So then I'm going to take the gauze, I'm going to put the gauze into the saline, and get it wet, and then then you'd have to bring out the gauze. Make sure you got a lot of the wetness out, and then you'd kind of want to fluff it around, and you'd want to put that into the wound. And then I would take another piece of gauze, and I would do the same thing. I'm going to wet the gauze, and then I'm going to bring it out, fluff it up, and put it into the wound. And once I've done that and the wound is filled with the wet gauze, then I would take some of the 4x4s of dry gauze and I would lay them on top of the wound, like that. Then once that is done, I would take this to cover this bandage, to cover everything. So I would cover it with this. At this point, I would get my tape. I would make sure to note the date, the time, and my initials on one piece of the tape, because now I'd be taping this down. I want to make sure I was securely taping this down to cover, to have the wound, the bandage secured over the wound so that nothing was getting opened. And like I said, I would make sure that my name, my initials, the date, and the time were on there, because especially with these dressings, it's important that they're changed usually between every 8 and 12 hours. So that would be very important information. And then when I was done with all of that, I would remove my gloves, perform hand hygiene, I would clean up, and that is how you would perform a wet to dry dressing change.